Hello and welcome to the GRADD Dialogue. My name is Jiten Shah, and this month we're talking about the affordable health care. And my guest today is Regan Hunt. Regan is the Executive Director of Kentucky Voices for Health, the organization that I'm kind of proud and I'm honored to be serving on. That is a statewide organization made up of all kinds of different agencies and individuals with interest in promoting health and health awareness and education. Regan, we were lucky enough to get her from Louisville. She was working at the Metro United Way. I know she has very extensive knowledge in community building and also in some of the healthcare partnership. Has worked with the USA Health Alliance, Carolina Center for Medical Excellence, and as I had mentioned, also in Louisville Metro, United Way. She's a native of Pike County and has an undergraduate degree from Pennsylvania University and a master in public administration from Martin School of Public Policy and Administration, University of Kentucky. Regan, welcome, and welcome to Owensboro too.
Thank you for having me. It's my first real trip to Owensboro that I've actually got to drive around and see the city, and it's beautiful. I love all the construction going on. It looks like it's going to turn into a fabulous downtown pretty soon.
Yeah, absolutely. I think somebody was mentioning not too long ago who visited Owensboro. It's the way every entrance of Owensboro there's some construction going on. So I think that's a sign of progress anyway.
Absolutely.
So how long you been with Kentucky Voice for Health now?
I have been on staff almost 7 months now.
7 months.
Yes.
Wow.
My second week on the job was the beginning of the 2013 General Assembly short session. So I started off with a bang, talking to legislators, meeting with the Speaker of the House staff, meeting with the head of the Veterans subcommittees. 2 weeks on the job. So I have hit the ground running.
I know we had the former director on the show one time, Judy Mitchell, I believe. She's in Virginia or Maryland area.
She's actually in Ohio.
In Ohio.
Yeah, near Cleveland.
Okay. All right. So. Okay. Now let's for the people again who may not know what is KVH. Can you give us a very brief introduction to the KVH?
Sure, absolutely. Kentucky Voices for Health is a coalition of over 250 organizations and individuals who are committed to building a better Kentucky together. So it's everything from an organization like GRADD to an organization like American Heart Association or AARP or an individual, living in Henderson, who are all committed to the work that we do.
I know at the board meetings of the KVH, we always have a lot of discussion about the policies, the health policies, and how is the Commonwealth ready for those kind of things. And then recently, I know we heard a lot of discussion about what KVH can do in getting the message out of the affordable health care. So tell us the connection between the affordable health care and KVH and your mission to make sure that we all get the right information.
Absolutely. Well, the Affordable Care Act was signed into law in 2010, and it has been, pieces of that have been instilled and installed ever since then. So there's been things like making sure that children with pre-existing conditions are not denied health care coverage. But every few months, something else gets implemented. So whether it's women's preventive health or whether it's prescription drug costs, cheaper prescription drugs for elderly people. So what Kentucky Voices for Health is doing about that is making sure that people know these things, that they know what provisions have been implemented, what provisions are coming. And we do that by, talking to folks at the GRADD, talking to, librarians, talking to people at church feedings, speaking at the Kentucky Rural Health Conference in September, speaking at, different events, big and small, just to let people know that what is happening, what has happened so far, and what's coming next.
Now, the length of this show is never going to do it justice in totally understanding what is in affordable health care and when it becomes effective and how it affects and everything else. So let's kind of talk about, tell us, what are some of the myths and misconceptions that you have heard in your efforts to get the right message to the audiences in the Commonwealth?
Well, I think one of the biggest myths that we've heard so far is that people seem to think that every employer must provide health care coverage starting January 1st.
I see.
And that is not correct. For small businesses, which are businesses under 25 employees, they do not have to provide health care coverage. They can. And in doing so, there are many options out there available for them to find out what's the best coverage option for their employees. But it's the organizations or employers with 50 or more employees. Most of those employers already provide health coverage. So a lot of those employers, nothing is going to be changing unless the employer decides to explore getting a new plan, or whether they decide, the employer themselves decide to make a change. So it's not really affecting, that change is not really affecting that many people. For those employers that do, big employers, large employers, that do not provide health coverage to their employees, in 2015, they will be penalized for not providing coverage. They're still working out the details in terms of if you work someplace that doesn't provide coverage, but you get your own coverage, how to make sure that that translates so that, one, the individual employee has coverage, and two, the employer does not get penalized because they have coverage in an alternative way. So that's one of the biggest nets.
Now there are many residents, and in fact, on the Medicaid eligible, I think we heard about over 600,000 people do not have health insurance. And I know we can talk about the medical expansion, but also there are individuals who do not have health insurance for some reason. They're working or non-working, or just do not believe in health insurance and all those things. What are some of the options for them?
Well, if you have never had health coverage or been denied health coverage due to a pre-existing condition, such as cancer, end-stage renal failure, you cannot be denied coverage. There is a plan out there for you to be covered. So that's one other thing, is that you can find coverage now, no matter what your situation was in the past. You'll be able to find that now. But I think the biggest thing is just there are options out there. I mean, the state is running its own exchange, which is different from a lot of other states in the country. Kentucky's the only state in the South running a state-based marketplace. So we get to look at making health insurance plans fit good for Kentuckians, to make Kentuckians healthier. And within that marketplace, there's going to be lots of options. I mean, it's kind of like, being able to go to Walmart and look at the cereal shelf and seeing at least 4 aisles of cereal, and within those 4 aisles, multiple options. So being able to have a lot more choice.
So it's a smorgasbord of health coverages, but you can choose what you want to do.
Absolutely, that is your choice. And this state-based marketplace is going to be able to help you determine what's the best fit for you. Which, if you're a first time of doing this or have not done it in a while, there's going to be people you can call, people you can meet with in person, or even there might even be online assistance as well to help you walk you through the steps of what you need in order to access your healthcare options, and then also to kind of help find the best fit for you.
Now, Regan, in the 7 months that you have been with the KVH, I would say one of the biggest feather in your hat is to get the enough movement and activities, to support and convince the governor to extend the Medicaid, or expand the Medicaid, the coverage and everything else. That added additional 300,000 residents who could get the health insurance. Now, people listening to you and about this affordable health care, and all of a sudden they want to see, now I would like to find out, and how, so if you would put yourself in their shoes, and how would you go about how to select what is the right insurance for me, and what are some of the ways you would go?
Well, first of all, you get more information. I would go to the state marketplace website, which is called Connect, kynect.ky.gov. That would be the good place to go, because there are fact sheets for individuals, fact sheets for families, and fact sheets for small businesses. And the next thing that I would do would start talking to there's a 1-800 number, 1-855-4-CONNECT, KYNECT. Call that number, and they'll be able to answer some questions that you may have. Right now, at the time that we're talking about this, the portal's not open, so people can't go shopping to see what's out there yet. And we have a group of individuals called connectors that they'll be able to talk to as well. And we just found out
connectors.
Connectors. And the connectors, we just found out what agency is going to be connectors late last week. And that's the community action here locally. So right now, people just need to understand it's coming, understand that enrollment starts in October, and start asking questions.
But then again, if you go on those sites and you again bombarded with all kinds of information, and so would there be something there on their sites so you can fill out some of the questions and bingo, I can have my choices like you described the Walmart being there, Yeah.
Absolutely. Starting October 1st, all you need 3 things in order to log on to get your portal information: your name, your date of birth, and your social security number. And once you put those 3 pieces of information in, it will tell you what you're eligible for. So whether you're eligible for this expanded Medicaid program, whether you're eligible for private insurance, if you're eligible for a subsidy to help you pay for some of that insurance cost every month, and then walk you through the different options that you have available, how much you want to spend, and what's the best fit for you and or your family.
So you can customize based on your need and work with the different providers to see who can give you the best deal.
Absolutely.
Okay.
Absolutely.
I know it kind of simplifies that, but I think that's what we're talking about.
That's it. It's being able to finally take healthcare into your own hands to say, okay, I can pay this amount of money every month for health coverage, including the subsidy. What can I get for that amount of money?
And that affects the people who do not have an health insurance or may feel like their health insurance is not adequate. They can do that. But those of us who already have a health insurance through the employers, there are not that much changes unless the employer decides to change the plan.
Exactly. Okay. Or if something happens and the insurance that you have through your employer doesn't fit your needs. I once worked for an organization where we had a great health benefit, but we didn't have any prescription drug coverage.
I see.
And that becomes catastrophic if you have, need to take medications consistently. So if this had been around during that, organizational experience, I would have gotten online to see, what my other options might have been. I'll be using Connect to get my own insurance because I'm the only full-time employee at Kentucky Voices for Health. So I will be getting on there to see what, compared with my current coverage, if I can get a better deal.
Now, and when we say people go through that exercise online or through calling 800 number that you described and provide the information, are the agencies already in state who will provide you the insurance?
Absolutely.
Okay.
We've heard kind of through the underground who some of those healthcare organizations are going to be. But before September 1st, we will have a list of who those healthcare or health insurance companies will be, and they'll be public knowledge. So you'll be able to see across the state what's available for you. We may even have some smaller local health insurance providers that may only be regionally that will be able to be accessed through Connect.
Now, but the first time it was announced, I know that recently the president even extended the small businesses that had to be providing, or this doesn't become effective for them right away. Right. So in the minute that we have, tell us about some of the deadlines that we are looking forward to. What's going to happen in 14, 15, are they, some of the milestones?
Well, October 1st is the beginning of open enrollment.
In Kentucky?
In Kentucky, across the nation. Across the nation. Okay. January 1st is when all of these great provisions start around pre-existing conditions, around extra prescription drug coverage, making sure that all plans have 10 essential benefits. March 31st is the end of open enrollment. This is so when everything wraps up and you need to have decided a plan. And then the only other date I can think of right now is that for employers, that penalty that they may have to pay will not become in effect until 2015.
All right. Regan, thank you for being on the show. And I think people can get more information on KYNECT, connect.ky.gov.
Correct.
All right. And what was 800 number?
1-855-4-CONNECT.
All right, great. And again, I want to wish you best of luck. And as you go on, getting this message out across the 120 counties about the affordable health care, along with some of the health and education programs that we have been working under your guidance. And I want to thank you for being on the show.
Thanks for having me.
And if you have any questions about the affordable health care, how does it affect you personally, your family, your business, or even you as an employer, please contact the GRADD office, and we can probably get you in touch with KYNECT at ky.gov, as well as the Regan Hunt at the Kentucky Voices for Health. Thank you very much.
Remember when 30 seems so old now? looking back is just a stepping stone to where we are, where we've been. Said we'd do it all again. Remember when?
Hello and welcome to the GRADD Dialogue. You know, one of the biggest things that has been talked about in the last couple of years or so is the EMC, Elizabeth Munday Center. You know, there has been a tremendous work by the seniors and by the Munday Center board, along with the mayor and the judge and in our communities to figure out what needs to be done to provide a better facilities and services for the seniors. And I think you would talk to, Tom at this EMC, they will tell you there's the fastest growing population. Look at the demographics, the fastest growing population in the country as well as in Daviess County. So the challenge remains what needs to be done. It's the wisdom of the mayor and judge to put together a senior center advisory committee. I believe that's what the name is. Advisory committee. And today my guests are two co-chairs of that committee, Keith Free, who is the community development director for City of Owensboro, and Gary Adams, urban planner. For many years we worked together, and actually I'm so proud that I could have both of you on this show because I have worked with both of you, as a part of the GRADD. And so for Keith, he is the community development director. Has a degree in cartography with a minor in city and regional planning from Western Kentucky University. Also public administration degree from Western Kentucky as well, and American Planning Association certified planner. Very proud of that. And his main responsibilities in housing rehabilitation programs for the city, neighborhood revitalization, as well as downtown development in the city of Owensboro. Now Gary, urban planner. I'm glad that it's a former urban planner, because once you're urban planner, you're always urban planner.
That's
so he has a degree from UK in architecture. And has been with Gary with Owens Metropolitan Planning Commission for 29 years. That's why we started working together. And I retired from there, and in 2004, he's been busy on almost every group that talks about design or facilities. Active in the Riverfront Design Steering Committee, Owensboro Historic Preservation Board, and also formulating the downtown placemaking. Master plan and zoning regulations. I think downtown placemaking, Gary, you should get a seal of excellence, the way the downtown looks right now. That we already made a place there. So let's talk about the Senior Center Advice. Is the right word, or the EMC?
Actually, it's a Senior Center Advisory Committee.
All right, all righty, okay. Tell us who is on that committee, and what was the charge given to you by mayor and judge?
Okay, Gary, I'll let you take
Okay,
that.
I'll tell you who's on the committee. Of course, Keith and I are co-chairs. And added to that, Keith represents the city, or he was appointed by the mayor. I was appointed by the county judge. And then the mayor also appointed Amanda Rogers, who's the city parks manager.
Right. A former GRADD employee too.
And former city commissioner Roger Stacy.
Right.
And then the judge also appointed Carolyn Adams, who's with Daviess County Sand and Gravel's, familiar with construction costs and things of that nature. And Christy Cheney, who is with the Glen Funeral Home.
Right, right.
So that's the makeup of the committee, and I'll let Keith tell you what we're charged with doing.
All right, what is the mission?
I think the mission is fairly complex. It's to look at all of the studies that were done. I believe GRADD did a study last year looking at this particular subject. The Elizabeth Munday Center group has been working for the last 4 years on collecting data and looking at plans for a new facility. And what the committee is charged with is to look at all of that information, take any new information, and give some specific recommendations to the elected officials in the city and the county in order to move forward with determination of what are the needs for the existing facility and any future facility or expansion of existing facility.
But the committee did determine that the time has come to move from existing Elizabeth Munday Center. Are you guys still looking at that location or maybe that is still in the discussion?
We're still in the process. Everything at this point in time probably by the airing of this, is still on the table. So we're looking at everything. We're trying to be very open and honest in the discussion that's happening in the meeting. So you know, we're looking at all the different opportunities and aspects, and so anything at this point is on the table. But probably people have read in the paper some of the things from the meeting that have been some of our comments or ideas or a review of this or that, and so we're moving right along. And our goal is, as a committee, is to have a very specific recommendation by the end of the year.
Right. Oh, okay. End of the year. Now, Gary, you know, being urban planners and being an architect, I would imagine you are also looking into a building that would be a, you know, kind of some sort of meet the future need, a future demand, you know, for the residents, the seniors, and all that. Or
well, certainly. I mean, there are demands of newer senior centers that incorporate more open, colored, light inducing places where people can feel comfortable and be drawn into, that maybe the current center doesn't exhibit as much of. But not to say that the current center couldn't be altered to do that. But those kind of features are the things that we'll be talking about and looking at also, because the future users of this center are going to demand that. Baby boomers don't want to think about themselves as being old per se, you know, and they're very active, and so you think about a facility that has more connection to the outdoors, to recreation, as you were mentioning before, that we have to have that kind of new look at what the activity range might be in a building, and then what the implications are for the architecture of the building to achieve that.
You know, I mean, when we looked at the study and when we were doing the study, one of the things we did was to do a survey of seniors, and I think I would say, unfortunately, the survey might have been filled out more by the seniors or themselves, or you know, seniors who are participating or could be participating. The biggest $69,000 question is, you know, what does baby boomer want, you know? And so far, not just the, you know, your committee or the Daviess County, but it's a question that people are struggling all over the country, you know. Should we make a, you know, big technologically active center, or do you make a, you know, a center that has just mainly social interactivity or something? So how would you go about to find out, you know, what they would need?
I think it's going to need a little bit of all of that, and it's going to have to have the opportunity to expand as the different demands change for the facility. I think one of the really important things is, with whatever, you know, fixing up the existing facility or having a new facility, is that it needs to be something that excites people. It not just draws them in, but you know, one of the things that in realizing, you know, looking at our population here in 2010, 15% of our population is 65 and older. And then looking at 2030, that's going to swell to 22%. So this age group that's going to need these services or demand these services are going to be one of our fastest growing age groups in our community. So it's going to be very important that we fully look at a facility that addresses all those different things. You know, looking at the technological aspects of the facility, as well as those socialization activities as well, and also, you know, looking at a facility that will foster a future where seniors are more looked at as an asset than a liability, because they're going to make up such a good piece of our local population. We need to maximize their creativity, their excitement, and their energy into our community, because it impacts everything from schools to social service agencies and everything that in local government and boards and things like that. The folks are going to have a significant impact. So it is challenging to look at that. But as we look at that, you know, we've got to look beyond just having something better than we've got, or an improved version of what we have. We need to think of something that may be completely different, and not even something that is City X has this, and that's exactly what we want. What we have may not exist,
Right.
And it may be something that needs to be created here that's specifically for our existing and our future seniors.
I know that that's a big laundry list of things that you should be looking into. I agree with all of them. It's a short time the committee has been working on this. What is the next step? What do you? I know I read somewhere that you are taking a tour of the town to look at different facilities or locations. Or
yes.
Okay.
Next week we're going to be taking a tour around town of potential sites. And we're going to do that. I think we're going to be doing that next Monday, and we're going to look at probably somewhere between 7 and 10 potential sites, so that all the committee members get a feel for the site, instead of just looking at it on paper. Actually, get out there and see what it feels like, because there's a lot of things on if there is going to be a new facility and it's going to be at a different location. There's a lot of things that come into play on that, on making sure that it's something. Where that it's creating a sense of place, that draws you in, and the setting is going to be very important. And as we've done everything in our region and in our community, to the highest level, beyond what the minimum expectation is, and this would be no different on the energy and the thoughtfulness that we want to look into what a facility like this needs to be.
And again, Gary, I think you're talking about the future sites, not the future buildings. And I mean, you're looking at it could be existing building, or it could be a greenfield, whatever that is, and that comes out of you. Because again, you both talked about your background too, the placemaking and everything else. City County done a tremendous job, of new image in downtown and all the new facilities and event centers and everything else. So I'm sure, with the energy that you have, looking for a location or building that's going to have some complement to all the things happening in the city of Owensboro and Daviess County.
Right. Plus, be located, to meet certain criteria that be accessible to a large proportion of the population of Daviess County, be easily accessible, be on transit routes, have availability, very high-speed internet. I mean, there's a whole range of things that you want to have beyond just the characteristics of the architecture of the building. Its location, implied.
Are there any discussion in the planning phase of involving the community somehow as a whole to provide some input or what the people are thinking in their own mind? And I know the survey we did was kind of very limited respondents and all that.
I think the main focus is looking at all the existing information and then pursuing additional information. That may be a part of it. That's yet to be determined by the committee. We're certainly, I think one of the things we're certainly interested is looking at partnerships. Are there partnerships that have not been thought of or have been thought of to consider as we're looking for a recommendation? So there's definitely more input that we're wanting to receive. How that will occur, whether it occurs prior to the recommendation or after the recommendation, when the city and county elected officials look at funding and working with the Munday Center on how to do that. There certainly will be public involvement at that stage of it as well.
Well, both of you, I think it's a lot of things on your plate for the committee. You got 4 months to come up with a solution, or at least a recommendation anyway. I want to wish you best of luck, and as you know very well that GRADD, we have a tremendous stake into this whole project itself, because I think we want to make sure there is a facility to provide all the aging services that that we contract through the federal government, and so but beyond that, I think we need to have a facility. We all very proud, and then we lost for the future need. So, all three of us can meet together and maybe, exchange, Facebook or whatever comes up in that time or so. Again, I want to thank you for being on the GRADD Dialogue, and I want to thank you and your committee members for the great work you are doing. And I would imagine the city, county are very proud of the effort and energy you're putting into it. So, thank you very much.
Thank you, Jiten.
All right.
Thank you,
If you have any question, thank you, Gary. If you have any question about the work being done by the Senior Center Advisory Committee that is formed by city and county, you can always contact me at the GRADD office, or you can always contact either Gary Adams or Keith Free. I would imagine the city or the county, and I'm sure those both are very well known in town. So you you can't miss them to find out. Again, thank you very much for watching GRADD Dialogue, and have a great day.